Idaho Matters is one way to learn about the people, the places, and the things that make Idaho unique. From the geography, the flora and the fauna, to the culture and arts of this place that we call home. Subscribe and listen to Idaho Matters today at boisestatepublicradio.org/podcasts or wherever you listen to podcasts. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Every year, millions of people in the United States are impacted by domestic abuse and violence. And making the decision to get help can be hard, especially for those living in rural areas where resources can be limited. So that's why here in Idaho, one nonprofit is working to break down barriers to assistance. Advocates Against Family Violence recently partnered with several agencies, including Valor Health, to expand their services in the Treasure Valley's rural communities. Joining us now to talk more about this effort are Kim Dugan, Executive Director of Advocates Against Family Violence, and Billy Osterhout, Acute Care Manager with Valor Health. I want to welcome both of you to the program.
Thank you for having us today.
Yes, thank you.
So, Kim, let me start with you. Can we begin by telling us a little bit more about Advocates Against Family Violence and what you do?
Absolutely. We are very proud to say that we've been serving survivors in the Treasure Valley for 21 years now. There's such a strong need for survivors to be able to reach out in their time of trauma. And we've been able to foster our program and to grow our programs. We have 14 programs and classes that we're able to help the survivor on their journey to a life free of violence.
And Kim, where did the idea for this expansion come from?
We had seen a strong referral from the surrounding communities, especially those that are more rural. They don't have access to a lot of services in the rural communities. And for them to be able to get in their car and drive to a community where there is a program, it's sometimes very hard for them to reach the services that they need. And so we were seeing a real increase in the referrals to our program and a request for our program to be able to serve in the rural communities. And so we decided that we would seek the funding and figure out how to get it done. And that's where this came from.
So, Billy, tell us a little bit about Valor Health and what you do there.
Valor Health's a rural area hospital out here in Emmett. And right now I am a acute care manager, so I oversee the med-surg side of things, as well as dialysis and starting the SANE program. And we have so many new resources coming, and this is just one of them that I really have dug in, and we really want to provide anybody that's having any sort of traumatic event with empowering the survivors and providing them with the resources and guidance that they need to reclaim their lives.
So, Billy, why was it important for your organization to get involved in this new effort?
This is very important for us because we've never had this program out here before. And so we have to transfer these people that are coming in over to Boise. And a lot of the time that can re-traumatize people and kind of shy them away from wanting to come and seek help when they really need help. And we are wanting to make it a safer, more compassionate environment for everyone and prioritizing healing and offering essential support to survivors who encounter obstacles in seeking help.
So, Billy, you mentioned you're based in Emmett, which is a smaller community. What kind of support does a community like yours traditionally have in order to help victims?
We have a Rose Advocates, and we have our prosecuting attorneys, and we have our law enforcement and EMS. And now with working through Idaho State Police and getting our nurses out here SANE certified, we're able to team up with the advocates and offer even more.
So, Kim, tell us where you're expanding the services.
We will actually have a full-time advocate placed at Valor Health, and then we will be sharing a full-time advocate between Middleton and Caldwell. And they will be working with the police departments, helping provide the advocacy and support services that the survivors need.
So, Kim, I'm going to make the assumption that you've seen a large need for support from these communities you just mentioned, like Middleton, Emmett, Caldwell, other parts of Canyon County.
Yes, absolutely. A huge need. And,
And
I'm sorry, go ahead.
no, I was just going to ask you. So, talk to us a little bit more about that and what kind of needs they have related to you.
Right now, the financial crisis that the country has been in has placed a real crimp on those that are willing to support and give to organizations. We've seen it across the board with all nonprofits, and we're a real heavily service-driven organization, and so it takes a lot of funding to help support these programs and to bring the staff in that are trained and especially trauma trained. That there's a lot of training involved with that, and the cost to do that is exponential. And so through the support and help of the grant that we received, this will be a 3-year program, and then through that we will also be then doing the fundraising and seeking those in the community who can partner with us in this critical need for the survivors.
So, Billy, what kinds of need does a community like yours? What kind of services really do you critically need?
We are seeing an influx in domestic violence right now and sexual assaults, and this program is going to bring exactly what we need to be able to support these people.
So, Kim, my understanding is that you've partnered with a really diverse group of agencies with this new expansion. Can you talk to us about why you decided to do that, and also how they'll help support victims who are coming forward?
We've always been able to work real closely with our Canyon County because we are based in Canyon County. That's where our main campus is. And we've always been able to work real closely with those service providers and with the Caldwell Police Department and the Sheriff's Department. But in seeing this influx of individuals coming to us from the more rural communities, it was really critical to get those services out there to them. And so in being able to place advocates in the more rural areas, we'll be able to address this social pandemic. That's really actually that's what domestic abuse and sexual assault is. It's the largest social pandemic that there ever was or ever will be. And each one of the departments has reported an increase. I had the opportunity to just chat with Caldwell, and they've already seen a 50% increase this year in those reported with strangulation. And so it's critical that our program and the strength of our program be able to help all of these other programs on support the services.
And Kim, I must imagine it's got to feel good for your organization to be able to move forward with a program like this, knowing, as you just said, that these incidences, are being reported more. It doesn't mean they necessarily haven't been happening, but more people are coming forward.
Exactly. And I think the fact that the victim is feeling more secure in making that report and knowing that there's going to be those support services there to help them on their journey, they're more willing to report then. If they feel like there's safety in that and they know that we're there advocating on their behalf, they're going to be much more likely to report than to have it go unreported.
And Billy, how will this new partnership help your patients at Valor Health?
Well, connecting with the advocates against family violence has been truly a rewarding experience. Their involvement in introducing valuable insight has been amazing. Our community-based resources that they're bringing and the support for individuals navigating through traumatic experiences. And together we'll be able to establish our SART team, which is our sexual assault response team, with our law enforcement and all of our crucial key players in this type of care. We want to just deliver exceptional, compassionate care, and with a strong focus on minimizing the re-traumatization of what's going on with them.
Well, I want to thank both of you so much for taking time to talk with us about this new program. We've been speaking with Kim Dugan, Executive Director of Advocates Against Family Violence, and Billy Osterhout, acute care manager with Valor Health, talking about AFV's recent expansion of their rural services. I'm Gemma Gaudette, and this is Idaho Matters.
We could all use a little help navigating the news these days. The Consider This podcast wants to give you a hand. 6 days a week, we'll help you make sense of the day's biggest news story and what it means for you in less than 15 minutes. Listen now to the Consider This podcast from NPR.